E1305 was a phase 3 trial of chemotherapy or chemotherapy plus bevacizumab. And it was conducted in the cooperative groups. It was conducted over the era where cetuximab got approved for first-line therapy, and actually towards the end of the trial overlapped with the early studies of immunotherapy in head and neck cancer. So I think it was written with assumptions that were based on a different era in head and neck cancer, and this left the trial a little bit underpowered. So we saw a significant improvement in response rate with the addition going from 23 to 36% with the addition of bevacizumab to chemotherapy. There was a statistically significant improvement in progression-free survival. And then there was a difference in overall survival that did not meet the statistical test for significance. Median overall survival went from 11 to 12.6 months. The 11 months in the control arm was a bit of a surprise, and we do not understand why the chemotherapy performed so well there. Just for reference, in the extreme trial, the same type chemo regimens would have had a median survival of about 7.5 months. So it could be that because we were concerned about the risk of bleeding from bevacizumab, and the trial was written to exclude patients who were at risk for bleeding, that we selected a better group of patients. That's one possibility. The other is that over time people had become much more comfortable with using taxanes in head and neck cancer, and a substantial proportion of the patients on the study got a platinum drug together with a taxane rather than a platinum drug together with 5-FU. So the study did show a modest numerical advantage in overall survival for the addition of bevacizumab that did not meet statistical significance, and whether that was due to treatments that the patients got after they progressed, or if it was sort of fallout of our statistical assumptions having been a little bit outdated, I think is hard to say. The presenter pointed out that there were about 7% of patients who at 4 years had not progressed on the chemotherapy plus bevacizumab arm, compared with under 1% in the chemo arm. So it appeared as if there was a small subset of patients for whom this was a very meaningful therapy. I don't think that this trial could support routine prescribing of bevacizumab in this setting, but I do think people are going to be thinking about bevacizumab as a potential component of regimens going forward, possibly even with immuno-oncology agents, because the difference in response rate and progression, those were significant and believable and clinically meaningful differences.